All right, good morning, everyone. My name is Jacob Fry. I'm the mayor of Minneapolis. And right now, Minneapolis students and youth are not just the leaders of tomorrow, they are the leaders of today. From climate change to gun violence and now to common sense public health reforms, our youth and our students are the ones changing hearts and they're changing minds. They're the ones going to the Capitol in Washington, D.C., or in St. Paul, or in city halls across America. They're the ones blazing that trail for change every single day. So today, young people in Minneapolis, they continued blazing that trail for change right here in Minneapolis and around our state. The unanimous vote that we just saw at the City Council is the result of your hard work and persistence, so give yourselves a gigantic round of applause. What has made student and youth advocacy such a powerful tool for change is not just your talent, your extraordinary organizing, or your moving stories. You also have the facts on your side. We know from research and from doctors that T21 laws can reduce tobacco use among high school students, and it can save lives. That's why the change is happening so fast. We know that it works, we know that it has a substantial impact on our health, and we know that it will improve our cities and our young people. And so our city is joining a coalition of Minnesota fighting the tobacco lobby to reduce youth smoking. Bloomington, St. Louis Park, Edina, Plymouth, Falcon Heights, Shoreview, and now Minneapolis has joined too. And in addition to being a victory for public health, this ordinance marks a tipping point. It marks a tipping point in state law. The momentum is on our side, and I think we're going to see a bipartisan coalition at the state capitol that hears your voices too. Don't you think so? Yeah. So, due to some extraordinary work by our council members, Jeremiah Ellison and Andrew Johnson, due to some extraordinary advocacy to our park board commissioner, Latricia Vitaw, and all of these amazing students here, let's give another round of applause for the young people. Because of that work, right now, I am going to sign this thing into law. You ready? So this is going to be like on the count of 3, all right? Ready? 1, 2, 3. Let's go save some lives, everyone. So next, I would like to introduce Councilmember Jeremiah Ellison, who co-authored this ordinance. You know, he has been a champion of equity, champion of public health, and champion of improving the lives of his constituents on the north side. I am very proud to introduce to you Councilmember Jeremiah Ellison.
Man, I really want to thank all the advocates who really push this issue. I think that one thing that my dad always says is that, you know, politicians sort of see the light when they feel the heat, and this is something that we were definitely more than willing to do, but it's really the advocates, it's really the community that moves any policy, and I really want to make sure that we give you all your due credit, so thank you. I also want to say that, you know, as a new council member, it can be tricky to figure out, you know, how does this whole process work? How do we, you know, I really want to sink my teeth in. I don't want to kind of be lost in my learning curve. And I really, to that end, want to thank Councilmember Johnson for realizing that this is a public health issue that I had a lot of interest in, something I really care about, and really walking me through this experience of passing my first ordinance. And so I'm super grateful to him for bringing me on. You know, we know that we want to be able to support business, but you know, nothing that we do in this city can come at the expense of our youth, can come at the expense of the health of our youth and our communities at large. And so that's why we're pursuing this ordinance. We're going to make sure that we have a healthy city, that we have a thriving city, and our small businesses are definitely a part of that. But also the health of our individual citizens is a major part of that as well. And so, you know, that's all I have to say. Thank you very much, and thank you, Mayor, for signing this into law.
And this is an excellent first ordinance to pass, and I think is emblematic of a whole lot of the extraordinary work that is to come for Councilmember Ellison. So Councilmember Andrew Johnson has been a champion on this issue for a long time. He's been talking to me about this issue for at least a couple years. And he's been on the right side of history, but he's also the ideas guy. I always talk about Andrew. He comes in my office with an idea every single day, and this has turned out to be just an extraordinary one. So thank you for your work, Councilmember. Thank you for your authorship of this wonderful ordinance, and I'd like to introduce you to say some comments. Councilmember Andrew Johnson.
Thank you, Mr. Mayor, and thank you for your leadership on this and other tobacco issues. I got to get Betsy Brock up here. Please, come on up. It's not right for you to be back there. You've been side by side, just such an incredible advocate and leader on these issues of tobacco products. So one more round of applause. And Latricia as well. They're the dynamic duo, these two. So anybody that knows them. Well, I just couldn't be more proud to be here today and to work on this. And again, I don't want to belabor the point, but thank you so much to everybody who's here, all the advocates. This wouldn't have happened without you, and truly you are leading this push across Minnesota. This is such a common sense policy. We see so many young people, 95% of smokers, starting before the age of 21. And you're an influenceable youth, and you try things, and cigarettes are really easy to get your hands on, especially because seniors in your high school certainly can just go down to the corner store and buy them. We want that to change. We want our youth to have a fighting chance when it comes to smoking. And we know the best way to address addiction in smoking is by making sure that folks never start in the first place. And that's what this is about. And we know that the numbers are there. Now, this won't prevent every single youth from being able to get their hands on cigarettes, but it's not intended to. This is about reducing access in a common sense way that ends up saving lives. And we know that that's going to happen. In fact, we're really hoping that this happens on a state level, and we want to add to the momentum because it is estimated that over 30,000 youth in the next 15 years will not start smoking if this is passed on a state level. And in Minneapolis alone, this policy will help thousands of our residents who are young avoid starting smoking in the first place. And that's what this is about. So it's not every day you get to pass an ordinance that you know is going to help save lives, but I couldn't be more honored and humbled to be a part of it and to be standing here with all these courageous leaders and community members who've helped make this happen. It's from a council member standpoint, it feels easy compared to what all of you do. And so the real credit goes out to you. Thank you so much for being here. Let's get this thing done across the state of Minnesota.
That's right.
Thank you.
Thank you, Councilmember Johnson. Undoubtedly, this would not have happened but for your work and your leadership. And it most certainly would not have happened without the leadership of our young leaders. And so next, I would like to welcome up Darrell Pratt. He's a student leader in the Tobacco 21 Coalition. Darrell, we are proud to have you. Come on up.
Hi, my name is Darrell Pratt. I was born and raised in South Minneapolis. I just recently turned 21 and I just finished my junior year of college. I'm here today in support of Tobacco 21 because many of my friends and peers that I grew up with currently smoke tobacco or they use e-cigs, and I would say majority of them all started at a very young age. An executive from the company of Newport Cigarettes once said, "The base of our business is high school students." Unfortunately, that's true. When I was in high school, many of my friends and peers began smoking tobacco. And this led to me beginning to notice how tobacco products were being heavily advertised throughout my neighborhood and beginning to notice how this wasn't necessarily the case throughout other parts of our city or even in the suburbs. Each year, the tobacco industry spends billions of dollars marketing to young people, especially young black and brown people that look just like me. We need to break that cycle. I got involved with this movement because I personally seen the impact tobacco has had on the health of my community and the health of my family, and I wanted to do something about it. Tobacco 21 is one way to protect the next generation from a lifetime of addiction. So I'm here today to say thank you to the city council member and the mayor for adopting such an important policy. Thank you.
So next we have a really extraordinary person who is extraordinary in her own right as an advocate, but is also extraordinary as her position as a park board commissioner. Latricia Vitaw has been there really every step of the way. She's fighting for equity, she's fighting for public health, and she's doing such an amazing job. So next, I would like to welcome up my friend and your park board commissioner, Latricia Vitaw.
Thank you, Mayor Fry. So, as you all know now, my name is Latricia Vitaw, and I work at North Point Health and Wellness Center, and I'm also a newly elected Minneapolis Park Board Commissioner. Minneapolis has a long history of leading the way, enacting policies that protect people from the harms of tobacco. Today, the city took another step towards a tobacco-free future. Thank you, Minneapolis. The best way to ensure a tobacco-free future is to stop young people from ever starting. Getting addicted in the first place is a big problem. Tobacco 21 does just that. It is backed by science and will save lives. This policy is also backed by the community. Many organizations signed on to support T21, African American Leadership Forum, Indigenous Peoples Task Force, Mad Dads, Minneapolis Youth Congress, and the Twin Cities Medical Society, to name a few. The young people that I work with in North Minneapolis advocated for this policy. They're behind me. Thank you all. Let's give them a round of applause for all their hard work. The adoption of Tobacco 21 today shows these young people that their voices matter and that they can step up and make a positive change in their city. To all the young people who worked on this, I hope you will keep raising your voices and working hard to make our city safer, healthier, and more equitable. As an elected official myself, I know that it isn't always easy to take the vote or get out of to take the vote or get out on a limb for an issue you care about. Council members Johnson and Ellison, thank you both so much. Thank you for going out on that limb and doing what's right and having the courage to protect our young people. Today, the Minneapolis City Council and the mayor, thank you, Mayor Fry, stood up for what's right. They voted for health, and I'm so glad they did. I am proud to call this city my home, and I am proud to serve with these three great people. Thank you. And thank you to the entire Minneapolis City Council for that unanimous vote. That felt amazing. Thank you.
So next we have Dr. Michael Alward, who I understand has done some really stupendous work on this topic. Doctor, we would love to have you up.
There you go. There you are. Good morning. My name is Michael Aylward. I'm an internal medicine and pediatric physician, a program director at the University of Minnesota MedPeds residency program, president of Minnesota Doctors for Health Equity, and president-elect of the Medicine Pediatric Program Directors Association. I see patients at the Community University Healthcare Center, a safety net clinic that serves the Phillips Neighborhood Clinic. Every day in clinic, I witness the harm tobacco inflicts on the health of our community. In particular, I see the financial and human toll tobacco use takes, from the child struggling to breathe because they're surrounded by smoke, to the teenager who's vaping in the classroom, to the adult with lung and heart disease. Tobacco use impacts all of our lives, but the poor and vulnerable bear the highest burden. Adults under the poverty limit bear nearly twice the burden of tobacco use as people above the poverty limit. The human and financial costs to individuals and society are enormous. Tobacco use impacts health in many ways. Adults who smoke have higher rates of cancer, lung disease, stroke, and cardiovascular disease. Smoking makes chronic diseases such as diabetes and hypertension worse. Asthma in children is difficult to control if a person in the household smokes. And in young people, nicotine harms brain development and predisposes them to a number of behavioral disorders. Furthermore, teenage tobacco users become adult tobacco users, perpetuating the cycle of illness. This fact explains why e-cigarettes come in a variety of flavors enticing to youth, like mango and fruit medley. E-cigarettes are responsible for the first increase in Minnesota youth tobacco use in 17 years, with nearly 1 in 5 11th graders reporting tobacco use. Tobacco remains the number one cause of death in our state and our city. Each year, 6,300 Minnesotans die from smoking, and if use remains stable, over 102,000 Minnesota youth are projected to die from smoking. In Hennepin County, 1 in 7 deaths are caused by tobacco-related diseases. These deaths are entirely preventable through treatment and, more importantly, prevention strategies. There are effective interventions to help people quit smoking. However, nicotine is a potent habit-forming chemical, and often I see patients who have tried to quit many times, who struggle to quit despite health consequences, or who are only able to quit once the damage is already done. Ultimately, the best way to avoid the consequences of tobacco use is never to use tobacco to begin with. Policies like Tobacco 21 move our public health efforts upstream, where we actually prevent these diseases before they begin. Tobacco 21 is a life-saving policy. According to the Institute of Medicine, this policy will greatly reduce tobacco use among youth. It is estimated this policy will decrease tobacco initiation by 25% for youth 15 to 17 years of age. In Minnesota, this means this policy will prevent 30,000 young people from starting to smoke over the next 15 years. That's 30,000 young people who live longer, do more, and not be burdened by tobacco-related diseases. Beyond that, their children will benefit with decreased rates of asthma and asthma exacerbation, as well as from having parents who live longer, healthier lives. The downstream benefits of this policy will reverberate through generations of Minnesotans. I applaud the Minneapolis City Council and Mayor Frey for taking this bold and important step. You've shown us that this city takes the public health seriously and that you care about the health of the next generation. Thank you for adopting Tobacco 21. I hope more communities will follow your lead, and we need to take this to the state level. Thank you.
Thank you so much, Doctor, for providing that very real perspective. And finally, we have Sylvia Amos, who has an incredibly powerful story that I think everyone who cares about this issue should most definitely hear. Sylvia, thank you.
Well, good morning. My name is Sylvia Amos, and I represent the Stair Step Foundation and the Minnesota State Baptist Convention Women's Auxiliary. I am passionate about preventing tobacco use. I was part of the coalition that worked last year to restrict the sale of menthol tobacco, and I am part of the coalition that worked to pass this Tobacco 21 policy. For me, this is personal. Tobacco addiction costs me a lot. The life of my mother, the life of a husband, and the life of 3 aunts. This display shows you what I've lost because of tobacco. I wish my story was unique, but it's not. When I am out in the community, I hear so many stories like my own. Too many people have lost too much because of tobacco. My community in particular, the African American community, has suffered disproportionately because of tobacco. Tobacco companies have relentlessly targeted us with marketing, and we suffer from tobacco-related diseases at extremely high rates. When asked if he smoked, one tobacco executive said, "We don't smoke that stuff. We reserve the right to smoke for the young, the poor, the black, and the stupid." For too long, tobacco companies have preyed on our communities and profited at the expense of our lives and our health. You don't put profit above life. You put life above profit. That's what this policy does. We are taking the health of our community back and protecting the next generation from tobacco addiction. We cannot afford to have another generation sentenced to death because tobacco companies need to replace those who have died with new, young smokers. To the Minneapolis City Council and Mayor Frey, thank you for standing up for the health of our community and voting to protect our young people. My sincere hope is that this policy will help prevent the type of loss that I have experienced. Thank you.
Thank you, Sylvia. That story was indeed powerful. You know, as I look around the room and I see these T-shirts, you know, there's something that I get really excited about. You know, catchphrases are great, but what's even better are facts. And if we could have one of our young people come up here so we can get the cameras focused in on your T-shirt, is that all right? Would that be okay? I want to show them your T-shirt. So, right? Get a focus in on that T-shirt, what it says. What it says is approximately 90% of adult smokers started before they were 21. If youth don't start before 21, they likely never will. Get a close-up of that shot, because this is exactly the message that we're departing today. So thank you so much. Great job. So again, thank you to all of the youth that have led this movement. Thank you to our council members that did the work in passing the ordinance. The press conference is over, but I believe our council members will be available as well as some of the organizers and activists as well. Commissioner Vitoff, if you have any questions. Thank you so much.